Assalamu alaikum wa rahmatullah. Good evening or good afternoon and good morning to all of our audience, started in reverse order from across the world. I would like to welcome our next panelist who will be represented in the next session, this session. So the session title is Blockchain in Healthcare, Opportunities and Challenges Post-Pandemic. I have the pleasure to moderate this with my colleagues, partners, scholars, and experts from across the region. Let me start first with welcoming Dr. Musa'ad Al-Razuqi, CBDO, Kuwait Life Science Company, Kuwait. I also would love to welcome Dr. Vikram Venkatis Hwaran, founder and editor-in-chief, Healthcare India. And then I would love to also welcome to the virtual podium Engineer Ali Shihab, President of Kuwait Association of Biomedical Engineers at Kuwait Society of Engineers. So in this lovely order, let me start first of all asking the panelists, starting with Dr. Musa'ad. If I could allow you, Doctor, a couple of minutes just to introduce your experience in blockchain and what has been your interaction in the healthcare space with blockchain. A couple of minutes, if that's okay, Dr. Musa'ad.
Thank you very much for the lovely introduction. I believe since 2017, when blockchain really became a very important buzzword, not just in healthcare, but in technology and in as an important pillar of the fourth industrial revolution, we haven't really seen it come back into the forefront of the technology space, and especially, I would say, by proxy, the healthcare space since then. Now, thankfully, with Bitcoin rising again, there has been renewed interest in the blockchain. Even back in 2017, 2018, I was very fond of saying that I personally am not a big believer in a big believer in Bitcoin, but I am a big believer in the underlying technology of blockchain. Now, there is no real practical application of the blockchain today here in the Middle East, unfortunately. However, we do notice that in 2018, the UAE launched a 2021 blockchain strategy and really took the lead here in the region when it came to actually trying to come up with a strategy to implement the blockchain as part of its Smart UAE, I would say, initiative. Many other countries in the region, I feel, do not understand the potential of this technology. I do not understand its application in healthcare. If I was to summarize, the reason the blockchain is very important in healthcare is because healthcare, first of all, deals with very sensitive information, and that's the patient and disease information. So obviously having a very secure technology backbone is very important. The second important part is that healthcare today and definitely in the future will be generating petabytes and petabytes or even exabytes of data. And the more data we generate, the better analysis we have to come up with this data, but at the same time maintain the protection and the privacy of the patients, from which this data is generated. And obviously, something else that's very important in healthcare is the high level of rising costs in healthcare. Today, unfortunately, medical inflation is much faster than normal inflation. I've seen reports that have estimated that over the past 10 years, we have seen a 700% increase in the cost of healthcare. Now, obviously, a big part of that cost is patients utilizing different parts of the healthcare system, in instances where they don't need to, or sometimes using the same amount of care twice, what's known as double care. And so, again, this is where an immutable ledger and a decentralized ledger comes into play to make sure that patients do not double dip themselves and overburden the healthcare system by getting, for example, the same MRI done, getting the same number of tests done. So encouraging the different stakeholders in the healthcare industry to all be part of this blockchain, I believe is very important. And it's the role of our governments and regulators to encourage the adoption of these new technologies and to allow both the private sector as well as the providers or suppliers of healthcare to experiment with new ways. So we back in actually in 2018, we launched our own cryptocurrency coin focused on the region. It was built on the Ethereum blockchain. It was a ERC20. And unfortunately, it was met with a very, let's say, lukewarm response. Many people in this region did not understand the potential. Our idea was to sort of develop it together with our medical financing platform. And the idea was to have essentially one coin one token, not coin, one token for every particular medical DRG. For those who are not familiar with DRG, that's diagnostic related group. And I believe it was a very innovative idea. It was an idea focused on the region. Some of the providers understood, but again, the regulators, the payers, it was very new to them. And unfortunately, that project did not really, even though they invested close to $100,000, $150,000, it did not see let's say, the potential that we had expected. So I believe that definitely, the blockchain is a very important and integral part of our future in healthcare. And hopefully that we can come up with different initiatives. And I'm happy to learn from also my other co-panelists about more practical applications for the future.
Thank you so much, Dr. Musa'ad, for a wonderful introduction. I think on the same line, Dr. Vikram, I wanna get your angle of your interactions with blockchain. What have you been involved in, and how do you see healthcare being the fertile ground for blockchain to scale up?
All right. Good afternoon, all of you, and thank you for this opportunity to interact with all of you. I think Dr. Musa'ad pretty much summed up the problem, and I agree with almost all of his observations. So foundationally, the issue with blockchain is that its biggest use case, or the most successful use case, most obvious use case, is Bitcoin or the cryptocurrency, right? Bitcoin is an example of that. And what the crypto does is foundationally challenge the monetary policies of a lot of governments. And because of that, the governments are very wary of blockchain as a whole. A lot of people equate blockchain as cryptocurrency, which is not the correct way of looking at it. Cryptocurrency is one use case of blockchain. Why do I say that? Is because if there is an entity across the world that can really change the way blockchain is being adopted, it's the government. And the reason for that, especially in India, where we see the government coming up with a lot of standards, a lot of set benchmarks to be followed, and they have done it successfully for things like machine learning and artificial intelligence across industries. I mean, in healthcare, we have a new national digital health policy, but for things like even financial services, there are standards being set today. Unfortunately, the government has been very quiet on blockchain, and that's primarily because of the use of cryptocurrency as the most successful use case of blockchain. And that's why almost because of this, the entire technology is being condemned. The second challenge, which I see when I talk to a lot of leaders in India, specifically, and this might be applicable globally, is blockchain is yet to get out of the CTO's lab, the Chief Technology Officer's lab. So you have a lot of successful pilots, like Dr. Musa'ad said. You have a lot of, these point-in-time solutions. But the minute I have to broad base it and I start asking as a business, what is the return on investment on something like blockchain, or what is a successful business case for me? There's a big struggle within the organization, even within the technology group. So it's a technology pet project, which is not being adopted by business. And if you look at any studies done on blockchain, when it comes to adoption, the second biggest stumbling block after the government is the lack of a successful business case. The third area where I feel blockchain has a little bit stumbled is because of the rise of AI. There's only that much investment money chasing these technologies. So today, if you ask me, where is the big money? Who's investing in technology? It's AI. AI is being sought out as the next new savior for everything that all the problems we have. And this is evident from the number of interactions and working groups that are in places like World Economic Forum. In 2017, there were, I think, almost 45 to 50 breakout groups on blockchain, because that was considered the next big thing. And today, World Economic Forum is essentially, there's a lot of concentration on AI and machine learning. So obviously the investments are not falling. So all three are related, if you ask me. So I see a lot of potential for blockchain, but unfortunately, I don't think crypto is going to work out that well. That's my line on it. And the sooner organizations, individuals, product companies move away from crypto and start looking at other use cases of blockchain and try to create a meaningful business case that organizations can adopt, and the government is able to bring about standards, especially in India, I think we will not see the end of this tunnel. Having said that, in 2018, we did publish an extensive report on blockchain. It's available on our website, where we talked about all the wonderful things blockchain can do for healthcare in India. And there is no doubt that it is going to be an amazing platform that can save a lot of lives, reduce costs, reduce readmissions, etc. But till those three issues I mentioned are taken off, I don't think we will make a start.
Excellent, Dr. Vikram. I think you mentioned the role of government is important, ROI, and I'll come back to that as well, because you talked about it from a financial perspective, and the rise of AI. These are valuable points in addition to Dr. Masaad's point in terms of the beta and exabytes or exabytes of data that will entail the importance of blockchain, rising costs of healthcare, and the role of cryptocurrency. But very interesting points. I appreciate that, Dr. Vikram. Let me bring in Engineer Ali into the discussion now. And Engineer Ali, let me ask you, as the president of the Kuwaiti Association of Biomedical Engineers, what is your experience with blockchain? And I wanna look at, how did you feel when you first heard about blockchain years ago, let's say, and where would you see the meaningful use as put by Dr. Vikram for blockchain in healthcare?
First of all, I would like to thank you for this discussion about blockchain. And just to put the foot in the door, the healthcare industry today is more global than ever before, especially with the current outbreak. What happened is the challenges now, with the data accessibility and the implication of all the stakeholders and the providers during the COVID-19, and what happened, during this duration. Actually, there was a survey. I just went over it. Only like 5% of healthcare chief information officers have blockchain in their plan, and only if the survey 3,700 doctors, only half of them know or have or aware of the blockchain technology or platform. So you can tell that the whole process is going with the third party to be there for all the information and data process. As far as in Kuwait, the increase in number of doctors and the number of hospitals, we have almost 20% increase yearly in these numbers. So you can imagine how much information we need to manage and how much we need to process with the with all the plans and all the using all the, of course, one of the solutions using the technology. And as an engineer, I always like to use the technology to solve problems, and blockchain is one of the solutions for us. So what I do usually, I go over the contracts of the medical technology and medical equipment. These contracts can be smarter if we use blockchain. We can, of course, have more efficient, and we have a network of interaction and transactions between the trustless parties using these smart contracts. Also, we can have terms of agreements, enforced by using special codes stored in the blockchain. So, at the end of the day, blockchain is going to be a solution for us in the future, and we should be more aware and should be more using it in our plan in the coming future.
Excellent. No, I really appreciate those remarkable and practical examples that you've shared with us, Engineer Ali. Let me go back to Dr. Musa'ad and ask about the role of the pandemic and the lessons learned. How do you see blockchain coming out of this pandemic? How do you see blockchain helping us in healthcare in the new normal?
And definitely I agree with Dr. Vikram's point that I believe now artificial intelligence is the new important buzzword in healthcare. And even by extension, I would say telemedicine this year has had a fantastic year. And we had hoped that technologies like the blockchain would actually also encourage people, so it would also have a rapid adoption this year, but unfortunately it seems to have been forgotten. I always like to say that, the three buzzwords today in technology, I call it the ABCs. It's artificial intelligence, blockchain, and C is for cloud. Cloud definitely this year has had a fantastic year. If you look at different technology IPOs, whether it's, I think the most recent one was Snowflake. It had a fantastic IPO. I think it's the largest IPO this year. You have other great cloud players as well. Again, different old software providers today are moving to the cloud, such as Amazon, and they've done a fantastic job there. Healthcare, I think, is a little bit far behind. Both when it comes to the A's, the B's, and the C's. Today, I frankly see no, let's say, practical application for the blockchain. One that I could really would like to see somebody work on is when it comes to the distribution of the potential vaccines. Obviously, an immutable ledger comes into handy, right? Having all the different stakeholders involved in a blockchain where the data can be easily shared back and forth. I think that is a very important application. I don't know anybody working on it today. I understand that the WHO and that other, let's say, international organizations like COVAX are very interested in making sure that even the developing countries where there is low income have a access and a right to the vaccine. And I can't think of a better technology than the blockchain to make sure that we take everybody's needs into consideration, as opposed to allowing the free market to essentially prioritize those countries that have high incomes that can afford to pay the $15 or sometimes even $30 per dose that many of these vaccine companies are talking about. So I would see that as an important application. And again, to answer your question, I feel that the blockchain itself this year has not really, with the exception again of Bitcoin, which has gone back to its highs, I don't think it has really benefited as much as other technologies in healthcare, such as telemedicine, which this has been a record year for telemedicine. Even mental health this year has, I think, really achieved a lot of spotlight. I saw a report a few months ago that there were 55 different companies only in the United States. Now there are many around. Sorry, $500 million, $500 million. So certainly, again, there is plenty of potential for different technologies in healthcare. Healthcare is still a very broken system. And one application I can see with blockchain is in terms of setting up this database of different vaccine recipients.
Excellent. Thank you, Dr. Musa'ad. And I think you've hit a very good point here by mentioning vaccine management and the role of blockchain. So this is a very good point that will actually entail, the need for technologies now, such as blockchain, perhaps specifically in the track and trace. Dr. Vikram, and I want to leverage on your vision for the next, let's say, 2 years. when it comes to blockchain, and I know you mentioned ROI, and you connected the importance of the rise of AI and on the survivability of blockchain. If I may ask you to reflect on not just the financial ROI, but also the human ROI from a workforce and skill set perspective. Where do you see blockchain, and how can you see blockchain being lumped up with AI in the coming months, specifically as we venture into this new normal?
Yeah, so I think, Dr. Mazin, human capital is a big challenge when it comes to blockchain. It's my estimate if just the top two healthcare organizations in India decide to have full blockchain adoption, we will not have enough people, which is one of the reasons why a lot of the experiments and POCs have not left the CTO's lab. The other challenge that we'll face is that though the propagation of, and I will like to thank Dr. Musad for the lovely analogy ABC, the propagation of cloud today is ubiquitous. Everybody sees cloud. I remember the days when cloud was launched, and there was a sense of disbelief and also a sense of skepticism. It took us almost 10 years or more in some cases to really have the right kind of people to start implementing cloud from a human capital perspective. And even today, cloud, whether it's Amazon or AWS or Azure or some of the new emerging technologies, I see Google Cloud platform really taking up in certain countries as well. We see still a shortage of human capital. I think from a human capital perspective, we are not ready for the blockchain wave. I don't think we have planned for it. I don't think educational institutions have understood it. Even in countries which are very advanced, like some of the European countries, Estonia, in Japan, where blockchain adoption has been relatively higher, I don't see a real industry academia consortium picking up to create the right kind of human capital for blockchain. If you remember, the reason why AI and cloud have really taken off is because there was a lot of industry academia consortiums. If you look at MIT, they worked extensively on AI. I mean, they spent so much time on institutionalizing AI. And today we have blockchain where I don't see any of the major academic institutions picking it up globally. Can you look at one academic institution that has really put the marker down on blockchain and say, we're going to train people on it? And it's no different in India. We have the Indian Institute of Technologies that are extensively focused on AI, especially in different sectors. IIT Madras, for example, focuses extensively on AI in healthcare. And they have some amazing incubation, amazing startups, very, very breakthrough innovation coming out of it. Not a single one on blockchain. So that's our challenge, That's our challenge. So even if the government agrees to it and we create a use case that people can, deploy and then the standards are set and somehow magically the money chases blockchain, we won't have the people. So I think that's your fourth problem then.
Excellent. And Dr. Vikram, briefly on the role of government, maybe half a minute.
So I think government is key. If you look at Dubai, the wonderful things they've done is primarily because the government is promoting it. If you look at Japan, if you look at Estonia, all the countries, even Luxembourg is Malta, these are country-driven blockchain programs. While the private sector, like Dr. Musad and even Engineer Ali, can definitely chip in at certain stage, it is the government that kind of sets the benchmark. I'll give you one very simple example, Dr. Mazin. You have blockchain running in your organization. I will request your auditors to sign off on a report coming out of blockchain. If he agrees to do that, then you're very lucky, because it took them a while to even accept reports coming out of SAP, for example. And how do you think they're going to accept something coming out of blockchain and sign up of when the government itself has not given directions whether it's good to accept that? So there lies your problem.
That is very valuable, Dr. Vikram. Engineer Ali, as I'm trying to come down to your vision, your strategy? Because you mentioned a vital point earlier, CIOs and their plans and all across the providers and the survey that has been done. Where do you see them understanding the role of blockchain? Where do you see them scaling up? Because one of the biggest issues that I'm seeing is scaling up of blockchain-enabled solutions. What are your thoughts on this, Engineer Ali, as you reflect in the next 2 years?
I just want to also touch base on the telemedicine platform Dr. Musa'ad mentioned about. This was like a solution for many institutes, many doctors during the pandemic. And as you know, the social distancing and all these precautions issues, many doctors, they are forced to use the telemedicine platform. And this is one of the solutions that we always asked them to do it, but it happened because the pandemic forced everybody to use that. What I see is that the telemedicine platform, and of course it's going to be a blockchain platform in the future. If we use that, it will be an effective solution to provide the healthcare with improved access and control, patient and doctor. Of course, this is also an opportunity for the patient to acquire their health information, and of course, reducing the cost and save money and all these other conditions as well. Also, using the platform, this can be also like they can upload the images and laboratory results and all. So the blockchain is going to provide all the transformation of information and all the requirements that we need, especially in the healthcare, that we have privacy issues and we need the patient always looking to control the information with their doctors. So I can tell that during the next 2 years, because what happened to us during COVID-19, it was just like a warning alarm for everybody to change their thoughts and to think now about the blockchain platform and to use them. I think everybody has to put that in their plan in the future.
That's fantastic. Thank you, Dr. Engineer Ali, for reflecting on Dr. Musa'ad's telemedicine and the rise of telemedicine during this pandemic has shown us an important aspect of where blockchain can play a vital role. And I really thank you for bringing the concepts of privacy and confidentiality into the equation now, which will be a definite important aspect as healthcare is now venturing into a lot of track and trace projects, whether it's vaccine track and trace, whether it's cases, COVID cases track and trace, whether it's supply chain track and trace. The word track and trace has become the trend now. So I want to conclude, or I want to encourage the public to ask questions, please. You don't get the chance to speak with a wonderful list of scholars like I have in this panel every day. So please do use this and make sure that you connect with our wonderful panelists today, thanking them for the time they spent. But I want to come to a final question that I had is Dr. Musa'ad, and this in maybe a minute or less. I want you to reflect on the ABCs, and I thank you for educating us on that. ABCs, I like that. I will never forget it. What is number one priority if you are to advise a healthcare decision maker when it comes to ABC, or specifically the B in that?
I know this is a blockchain panel, but if I had to only choose one, I would choose the C, the cloud, and that has very important implications for both electronic medical records as well as telemedicine, right? So that to me encompasses both. I want definitely both healthcare stakeholders in the government as well as the provider space to start and the payer space and the insurance space to experiment with blockchain, because again, it is as if this technology is made for healthcare, because we are talking about a decentralized immutable ledger, which can hold a lot of data in a very secure fashion and have different stakeholders involved. And that's exactly what healthcare needs. So I hope that answered your question very quickly.
Absolutely, absolutely. Thank you for that advice. Dr. Vikram, also in a similar time frame, what would you advise your healthcare decision maker, government employee or private sector leader when it comes to blockchain from your experience?
Yeah, I would say that today I think Amazon picked up stake in one of the largest Indian online pharmacies, and that shows their intent clearly. That this is something they tried in the 90s, didn't work out, and now they're back. So I think there's a big disruption coming in healthcare, right? I'm going to say this openly. There's a big disruption coming, and the ones disrupting it may be the technology companies or it may be somebody upstart. Some of the data companies, right? There are a lot of apps that aggregate data. What I'll request my healthcare peers to do is to start getting very serious in evaluating where is the business case, and don't adopt blockchain for the sake of blockchain, right? Because the industry is very important. This industry affects every human being on this planet, right? You can stay without books, but you cannot stay without healthcare. At some stage, you will need it. So choose wisely, choose the right technology, use business cases, and then make sure that the government understands that, okay, I need to adopt blockchain for X, Y, Z reasons. I'll give you a reason. In India, almost 25% of our drugs are spurious. They get mixed up with paracetamol tablets get mixed up with the glucose tablets. And that's a clear and present danger. And blockchain is a way to track. There's a very beautiful use case by which I can track all these drugs. And there are systems like ePedigree in the US that do it. But in India, knowing the system the way it is, blockchain can help. So look at the use case, drive the use case. Don't look at blockchain as blockchain. See if the use case fits blockchain, and then make a very strong recommendation to the government, because we are a highly regulated industry. This is an industry that even to practice medicine, you need a degree and you need to be registered. To dispense medicine, you need to be registered. Without the government, there's nothing possible in healthcare, whether it's in India or globally, right? So find the use case, lobby the government, and if it's not blockchain, let's knock it off. We go with A and C, right? But make care affordable, cheaper, better. That will be my recommendation, and I feel very strongly about it, right? And I want to thank Dr. Musad for setting the tone early on. I think we are here for a purpose, and the purpose is to improve care. And whether that's through blockchain, so be it. But if it's not blockchain, let's just walk away. Let's walk to A and C. Cloud is already proven. AI is knocking at the door as well. So let's go with those. But let's have a strong business case for that.
Excellent, excellent. And Engineer Ali, as we are leaving best for last, وختامها مسك, what is your number one advice? And I want to maybe put it in the context where you are a president of an association for biomedical engineers, and maybe with an important skill set from a competency perspective. What is your advice when it comes to blockchain coming in the next 2 years?
Well, I totally agree with Dr. Vikram. There is a disruption in healthcare everywhere, in all, globally, and it's just the reason because they are just spending because of spending. They are just, it's not supposedly to be the beneficial technology for you, but because it's expensive and it's for healthcare, then we will go for that. This is a disruption, as and believe me, we have here also to work hard to remanage the healthcare system as well. And I also advise everyone, when I see everyone here in Kuwait or anywhere, to go and see some of the places around the world that have been using blockchain. For example, Philips. In 2016, they established some blockchain laboratory. It's a good installation base. I advise everyone to go there and see it. We also have a telemedicine places around the world that are good installation bases to go and see and have a look at them and see how the blockchain is making the process of information and database more efficient, instead of just investing without any plan, or investing just because of investing in healthcare. So I see that blockchain as a solution, and it can save money and time for everyone, and we hope to see it in the future. And as I said, COVID-19 should be a lesson for us to learn for the future.
Much appreciated, Engineer Ali. Thank you, Dr. Vikram. I appreciate you, Dr. Musaad. This has been educational. I'd love the public and the audience to connect with our wonderful panelists, scholars and scientists in their all with the whole lot of experience. And please connect with our panel. Thank you again. I'd like to conclude this wonderful panel, and I appreciate our panelists for the time and sharing of their knowledge. Thank you.